Hi, it's Devon here again from Absolute Injury Management, Gippsland's Exercise and Sports Medicine Centre, and in today's video, you got it, we're talking knees again today, and in particular we're talking about the medial ligament, what it does, what it means, and when we injure it, how can we get back nice and fast. Okay, so we're talking medial ligament of the knee injury today. So if you look at the ligaments of the knee, we've got a lateral ligament out here on this side, which is the outside, and we've got our medial ligament sitting on the inside, and it runs from a bony bump on our thigh bone down past the edge of the knee joint line and then into the tibia. Now, cruciate ligaments, they sit inside the knee. So you can see a couple of ligaments in the knee. We're not talking about those today, we've talked about those in the past, but today we're mainly talking about this medial ligament. Now, when we think about what that medial ligament does, imagine this leg being on the ground and someone coming and hitting us from this side. It's going to make the knee want to buckle in this direction. And you can see that when I do that, and I separate the two bones here, I'm stressing this medial ligament. Now that's what causes the damage to that medial ligament. We generally grade that on a 1, 2, 3 scale. So if we think about a grade 1 injury, it's generally just some damage to a few of the fibers in that ligament, some simple taping methods to protect it, and some basic exercises around the knee is generally enough. Might be a rehab period of 1 to 2 weeks, or you can potentially continue playing as long as you can keep your pain under control. If we look at a grade 2 injury, then that's a more significant injury and there's more damage in the fibers of that ligament. So we need to let those heal, and because we need to let them heal before we return to sport, it'll prolong the rehab period, generally over a 4 to 6 week period. And yes, the nasty one is the grade 3. You can completely rupture that ligament or get some significant damage around it. And depending on the location of that damage, sometimes it does require surgical intervention. The two ends of the ligament just won't heal, so we need to surgically get them to come together. But in a lot of cases, conservative management will still work, and conservative management for a grade 3 often results in someone being in what we call a range of motion post-op knee brace. It's called a post-op knee brace, but sometimes it will be used for conservative, so without surgery, but it'll limit how much movement we have in the knee, and that will keep the ends of that ligament together so that it can heal and scar. And once it's scarred up and healed, then it still maintains that protection on the medial side. So from a physio perspective, what do we need to look at with medial ligament injuries of the knee? We need to see how unstable the knee is, so we need to grade it to start with, so you need to have that injury assessed by an expert physio. You also need to consider whether we can speed up the healing of the ligaments. There's some techniques that we can use to make sure we promote blood flow and we get good collagen alignment, and that can help speed your return. You also need to think about the muscle strength that you've lost, one as a result of the swelling and the pain from the injury, but two from the deconditioning that you may have due to the layoff period because of the injury. And then we also need to consider how we can protect it. So from a taping method, we can talk about a taping method where we put an anchor around the thigh and an anchor around the shin bone, and then we create a crisscross pattern with the center of the crisscross generally being around where that medial ligament is, and that will help provide the knee with even more stability if it happens to get stressed with what we would call a valgus force, which opens up the inside of the knee and puts the strain here. So by taping it like that, we can protect that medial ligament. So it's important that we teach you how you can do that as well. So if you have a medial ligament injury at the moment, or you know someone who has a medial ligament injury, then make sure you tag and share this post, or you need to make sure you get that assessed, as I said, and you need a good rehab plan to help speed that return to play. So jump online at absoluteim.com.au or give us a call here at the clinic on 5174 7250. Make sure you do the right thing by your knee. Thanks, guys.